Hello friends, in this video we'll talk about the last part of the fat soluble vitamins, that is vitamin D and E. So first we'll talk about vitamin D. So vitamin D has two forms, that is ergocalciferol D2 and cholecalciferol D3. Here cholecalciferol only we will discuss in detail. First we'll see the synthesis. You're observing here the 7-dehydrocholesterol. By light it is breaking down into secosterol and then cholecalciferol. Here secosterol is intermediate. Okay, don't worry about that cis and trans. Fine. Then cholecalciferol enters the liver by 25 alpha hydroxylase. We have 25 hydroxy cholecalciferol, and in the kidney by 1 alpha hydroxylase it is 125 DHCC, or I'll say 125 dihydroxy cholecalciferol, or simply calcitriol. Okay. Now calcitriol is going to enter into the intestine, forming the receptor. Okay, then it binds to the DNA surface. Then it codes for a protein, that is the calbindin, that increases the calcium absorption from the plasma into the bones. In the bones, it increases osteoblast activity. Okay. Here is a summary of the action of calcitriol. What does it do in elevating the calcium? So when the PTH is more, parathyroid hormone, that increases calcitriol by, and as I already said, it increases the calcium absorption in the plasma, in the kidney, the intestine, and in the bone. Okay. So the sources you are observing here, you have beautiful mushrooms, egg, green leafy vegetables, cheese, milk, to name a few, and even fish also. And RDA 10 milligrams per day is recommended in case of cholecalciferol. And applied aspect, let us see with the rickets and osteomalacia. Rickets in children, osteomalacia in adults. That is the difference. Anyway, common thing will be increased alkaline phosphatase levels. Bow legs is an important feature. And it can be seen in the kidney due to calcitriol deficiency. For such patients, we shall administer the calcitriol. In osteomalacia, there is increased fracture chances for the bones in adults. If there is excess of vitamin D, it causes hypercalcemia, nausea, etc. Here you are seeing the bone deformity, the bow leg syndrome you are seeing here, this and this. Okay. Let us see vitamin E. So this is called anti-sterility vitamin. Okay. So mainly it is alpha tocopherol. There are beta, gamma, other types. Don't worry about it. But alpha tocopherol is the common type, which is having a 6-hydroxychromane ring. I repeat this word again. 6-hydroxychromane ring attached to it. Okay. And it is metabolized in the liver along with vitamin K, with the lipoproteins and the bile salts. Okay. This will be stored in adipocytes, muscle, etc. This is not very important. Plasma level important. It's easy, plasma level. What I said for ketone bodies, serum ketone bodies, less than 1 milligram per deciliter, same applies for tocopherol also. What are the functions? Antioxidant, protection of the RBC, PUFA, synthesis of heme and nucleic acids, then prevention of chronic diseases, immunity also you can add, one function, amino acid metabolism in the intestine, same vitamin B6 also will do, then creatine storage in muscle. Okay, so briefly the functions. RDA, for man it is 10 milligrams per day. For women, it is 2 less, 8. Okay. Let's see the sources. Here we can see vegetable oils, papaya, tomato. This is a papaya, your tomato, vegetable oils, avocado, bell peppers, um, palakura. Okay, you're seeing palakura here, and this is your kiwi. Okay, please don't write palakura in exam. It is spinach. Okay, it is for just translation in Telugu. I told palakura. Okay, so briefly the sources you can see. So applied aspect, it will cause the megaloblastic anemia. Same what happens in B12 as well. Okay, ineffective muscle breakdown and damage to the nervous system. Okay, and this vitamin is not known to cause very much toxic effect. Okay, so that is why I am saying least toxic here. So references from where I took the pictures. That brings us to end of the video. So thank you so much. I'll see you in the next video.